It's a real honor for me to come to Grande Cache. I'll tell you, I have not been to Grande Cache before, and it's absolutely beautiful from the air, and there won't be much of an opportunity tonight to visit the community, but we'll have to make a point of doing that in the future. So thank you for the invitation. Thank you to Robin for inviting me, and I'm going to try to keep my remarks very brief, because I think the best thing I could do tonight is listen rather than talk, and certainly answer as many questions as I can. And I'm also going to ask Dr. Worry to say a few words when I'm finished. So the issue that you're dealing with, as Louise said, is an issue that we find frequently in northern Alberta. We find it to a considerable degree in southern parts of the province as well, where communities work very hard to recruit and retain physicians, and quite often for reasons that have nothing to do with the community, just changing life circumstances for the doctors themselves. They move on, they move to an urban center, or sometimes they move out of province, and some have even moved to other countries. And the cycle starts again, where the community has to work to recruit another doctor. And so I understand from Louise, just in the car drive-in, that this is a relatively new situation in Grande Cache, which I actually didn't appreciate the fact that you've had a lot of continuity in the physicians that you've had in the community. So I'll tell you a bit about my experience as minister in trying to help communities that are in this position. And I'm certainly not coming here tonight with all the answers. If there's one thing I could tell you, is every community that I've been involved with that's in your situation, the solution has been different. In some cases, it's the recruitment has been successful because there was a turnkey opportunity for a physician. So a medical clinic or a building where a younger doctor or doctors could go and set up practice without having the expense of overhead of starting a practice. We have very few young doctors in Alberta today setting out on their own, even in Edmonton and Calgary, to start a practice. It's just very, very costly. So I've seen a lot of situations where having a local clinic where doctors could contribute in rent to the space, but not have to take on all the responsibility of being a tenant and staff costs. That's worked really well in some communities. In other communities, it's been a case of not just providing the doctor with an opportunity, but his or her spouse, and so we've seen lots of doctor couples and doctor-teacher couples, and the community has had opportunities, professional opportunities outside of healthcare that have really sealed the deal with the doctor, so to speak, and resulted in the doctor making the decision because the opportunity was there for both partners in the couple. So I've seen that situation before. Other communities have provided housing, and I believe you've done that in Grande Cache as well. So people who are in healthcare, sometimes don't initially want to make a permanent commitment to the community in the form of buying a home and all the things that go with that, and they want to see how they adjust. So it's really been different everywhere I've gone. The one thing I would say that has been the common denominator from any doctor that I've talked to that's relocated to the north or to another rural area has been the sort of the character and the atmosphere in the community itself. So it's feeling that sense of belonging, not just having the job, but feeling welcomed by the community, being attracted to to things like the beautiful landscape here in Grande Cache, so the opportunities in the outdoors, socially feeling welcome and maybe having opportunities for their kids recreationally. Those sorts of things seem in the end, from any doctor I've talked to, that the community itself has been the deciding factor. And so I think your history of being able to recruit and retain your doctors for a long period of time must have a lot to do with the character of your community and what you can offer. Now, I wanted just to make a couple of comments about healthcare generally in Alberta and how it's changing, and I'll sort of close with some of the plans that we have in place in the short term to support you. We're very much focused at the moment on what's called primary health care in Alberta. So It is traditionally for most of us a family doctor that are lucky enough to have a family doctor, but increasingly it's the involvement of other professionals that work with the physician on a team. So I'm talking about nurse practitioners, physiotherapists, dietitians. There is something called a physician assistant, which we're just starting to get into in Alberta, but they use physician assistants extensively in the US and in the UK, and they are what the title implies. They're people who work under the direction of a physician alongside that doctor, so they kind of extend the services of the doctor to a wider number of people. In some places in the north, in particular, we're using paramedics working alongside doctors to deliver primary health care. So one of the strategies is to not just think about how to get a doctor into the town, but what are some of the other supports that if we can find professionals in those other fields to come in, what are some of the supports that we can put around that physician, so we're using the physician for the most complex, most sophisticated work. So that's part of it. And family care clinics, which you might have heard about, are really based on that principle, the doctor working with a team that supports the doctor. So that's been very successful. We have something called the Rural Physician Action Plan in Alberta, which I think the mayor has heard a bit about and made contact with. So this is a program that was started, I think, over 20 years ago now, to support rural communities and strategies to recruit and retain physicians. So the Ministry of Health gives funding to this program, and these folks come out and they work alongside you in designing a recruitment program for your community, and they support activities like advertising and word-of-mouth connections in networks of doctors, dealing with educational institutions, so the faculties of medicine. So there is actually a lot of support and a lot of funding that's put into the Rural Physician Action Plan. So that's something else that you can look at. There are, of course, lots of informal ways that doctors choose to come to communities. If I think of Slave Lake as an example, Slave Lake after the fire, within a year after the fire, saw 5 doctors leave the town, and they ended up with only one doctor remaining. So we put out the word quite extensively, especially in rural Alberta, that we were willing to try new things in Slave Lake because we had to provide health care for those people now. We couldn't wait 2 years to try to find someone and convince them to come to town. So we set up a family care clinic. We said we were open to trying new models of delivering care. Most people were going to the emergency department to get their basic health care services because the doctor couldn't be in 2 places at once. So we set up a family care clinic. We set up some special clinics with nurse practitioners and other professionals to handle things like diabetic care. It's very common, blood pressure, hypertension. So we gave the other professionals the opportunity, under the, working with the doctor, under the supervision of the doctor, to take a portion of the care needs of the community. And that freed up the doctor to see more patients. Eventually, we found that, and we have more doctors now in Slave Lake. How many we have currently, Kevin? 9. We have 9 doctors in Slave Lake, and with less than 2 years ago, we had 1. When I became the minister, that was the first issue that we were faced with. So we saw that the physicians were attracted to the community, but to try to do things a bit differently and to have some real input in shaping that was an attraction for them. So that's something that we can talk about with you in Grand Cache as well. So there's lots of options. So I'm just going to, I'm going to ask Kevin to explain about some of the short-term arrangements that Alberta Health Services has made to make sure that you have physician coverage. And I just met Dr. Gillette. I haven't had a chance to really talk with him yet, but Kevin is the zone medical director for the North. He is a family physician, and his job, a large part of his job, is around recruiting and supporting physicians. So he's made some short-term arrangements. Just before I pass the mic over to him, I guess the most important thing I'd want to say in coming here tonight is we will not abandon Grand Cache in this situation. We will not leave you in a position where you're trying to deal with this and fend for this and fend on your own. This is it's a common occurrence in Alberta, but it is one of the hardest issues to solve anywhere in Canada in a rural community that I'm aware of. So we'll talk to you tonight a lot about some things in the next weeks and months, but I don't want you to think that we're going to stop there. We're going to stay with you. We're going to make a point of finding out what worked so well for you in the past that gave you this great, history of keeping your doctors, and maybe put some other things with that and come up with a longer-term solution for you. But obviously we need to learn more about your community from you before we can do that. So really, if there's one thing I leave with you tonight, it is that commitment. And I know Robin's made that commitment to you, and Alberta Health Services does as well. So I'll introduce Dr. Worry to talk about next steps.
Thanks, Mr. Horn, and appreciate the opportunity to be here tonight. Certainly, as Louise had mentioned, it was a treat to connect on the weekend and talk about things. I should relate that a little bit about my background. So I'm a rural emerge doc. I grew up in Northern Ontario, where I decided I wanted to go into family practice was working up in Kapuskasing. So it's a similar isolated area to Grande, so I know it's a treat for me every time I'm out. I was out about a month ago because I have the pleasure of working with Dr. Gillette. And John, if you want to stand up for us. There we go. So I got to tell you, this man is nothing short of fantastic, and I'm not saying that because I'm here tonight. But I speak very sincerely that he is. Not only is our community medical director, he serves as one of my senior physician leaders who oversees a number of different areas. Been here, with his wife Essie for 17 years now, and came at a previous time, where Grande was very short on physicians, and it was with John and Essie stepping in that they provided that stability. Over the last little while and over the last couple of months, we started to become aware that for personal reasons, we were having 3 of our 4.5 dogs that were going to be leaving, again, for different reasons. It really has been John and Essie weighing out different things and really their commitment to say, how can we make this work? His creativity, his willingness to go ahead and look at different options and finding different ways of making sure that we're supporting the community. If we could replicate John, if we could produce more of them as they're younger and coming up, that would be great. It's not to call John old, that's just saying I would like more of him. So I guess what I should relate is, as John made us aware of some of the challenges that we were facing, there's a number of different things that we've been putting in place. I should also introduce the person sitting next to him. So Alison Chisholm. Allie, if you want to stand up. Allie's one of our physician resource planners. We've got 3 physician resource planners in the north, and Allie works very closely with RPAP. We'll work with a number of other key community stakeholders to identify a number of the things that the Minister Horn has highlighted for us. You have to find that not only the word of mouth, but you have to find the fabric of a community that attracts different types of healthcare professionals. Allie is somebody who focuses full-time just on those sort of components. And certainly happy to relate that we've been able to secure 1 new physician who likely will be starting here early in 2014. So that's exciting, but still means that we have a period of time to put in between now and then. So part of what we needed to be able to look at is what our immediate plans would be to go ahead and provide some support for Grande, as well as looking as to what the medium and longer term would be. And certainly, again, I'd highlight it's a treat working with John because he integrates all of those things. What do we have to do now? I mean, he's a rural emerge doc. You just got to do with whatever walks in the door and you find a way to make it work. So you got to deal with what's going on now as well as how do we plan for the future. So we have 2 other leads of physicians that are interested in coming. We have 1 doc who's actually coming for a locum in November. So he's coming from Saskatchewan and is interested in Grande. We have a number of other physicians that do fly-in, fly-out work. And what that can be is we have physicians that will come from either different provinces, other cities, and at times other countries that will come for a period of time, several weeks. They may even stay for longer, and they can share a practice. So 2 docs can share one particular practice on kind of a fly-in, fly-out basis. And so what we're trying to do is make sure that we provide that ongoing support. Because as John has highlighted, it's too busy here to go ahead and simply leave 1 physician. And we really need to move back to a complement of a minimum of 3, and then more. And as Minister Horn has spoken of, really need to make sure that we're providing support for all different types of care professionals. So certainly when I was talking to Tracy today, our site manager, Tracy's highlighting that again, you know, when it comes to nursing, when it comes to many other areas, when it comes to EMS, everything else, we don't want this to only be about docs. It really is a conversation with the community and that word of mouth and that support for healthcare professionals as a whole. So I would say that there still are, and from the work that Ali and her team has done, the work that John has done, we have 2/3 of the shifts between now and the end of the year covered, which at this point is very good. I certainly have other communities where that's absolutely not the case. I would not want to leave you with the impression that that has been easy, and I would not want to leave you with the impression that the work is done, because it's not. But I certainly have been very happy to see the work that and the plans that we've been able to put in place. Again, a major part of that have been the work of the two people we've introduced tonight, and in particular, John's ability to really passionately believe in people coming here, staying here, and what Grande has to offer. So I can get into some more details, Louise, but perhaps at this point would it be best to... Some of the details? Okay. So I think, you know, I think that as we are moving forward, we are exploring some different options. So John and I spoke quite recently, in fact, just again about the potential of adding a physician assistant in as something to provide some relief. Physician assistant, as Minister Horn talks about, is somebody that has med school training and would typically function, you guys will have seen medical residents here, so they typically function like an R2. It's someone that can provide support, but as I'm sure John would tell you, you know, really it's a sort of thing where you're going to need other independent practitioners that can provide that work as well. So certainly in Slave Lake, there was, you know, we had an interest in bringing in nurse practitioners. Again, people that could try to make it easier to receive that timely access to primary care. So we'll continue to explore all of those issues as we continue with the focused physician recruitment. I think when it comes to physician recruitment, certainly some of the information that Ali and John will highlight for you, in Grande, some of our issues will come down to accommodation. And so I know certainly, you know, Minister Campbell has highlighted that there are a number of steps that we're trying to look at and trying to explore, whether it's using EMS housing, whether it's exploring some of the housing we've got in town, whether it's, as Louise talks about, it's what sort of partnerships we can look at with the community to see how do we help out to make it easier for healthcare practitioners to come in for a period of time. So accommodations can be a key part. John, similar to Minister Horn, has a larger vision for something that provides more medium and longer term stability. And one of that is an interprofessional team, and an interprofessional team that can work potentially in different locations. In some communities, these things take place actually right next to the hospital. So it's called co-location. And that allows a lot of patients that are coming into the emergency department for family medicine issues to actually move over and see a family doc or a social worker or an addiction and mental health counselor, whatever is needed for that particular issue, and prevents as much of a stress, per se, on the emergency department. At times, and I know that Minister Campbell is looking at what some other options are available in town, it's exploring what might be available in the provincial building. And I imagine as we have our different table working sessions, Louise, that'll be some of the ideas that will come out. I know that there will likely be discussions that'll come from different companies and different corporate sponsorships that will be interested in how do we help. We've got workers in town, we're committed to going ahead, and again, good corporate social responsibility, how do we help out? We really appreciate everything that everybody brings to the table here. Having grown up in a rural community, knowing the word of mouth, it's really that sense of a small rural community, that sense of belonging that brings people here, that draws people in. And just the fact that we can have these sort of meetings here tonight, it's very helpful in advancing a lot of our recruitment efforts. And so really do want to thank you for the opportunity to be here.
Thank you both very much, Minister Horn and Dr. Murray. We'll give, I'm sure it won't be the last word, but I would like to call Robin Campbell forward to say something. He's always good at saying something.
Well, thanks, and I just want to thank everybody for coming out tonight. This is a very important issue, and just the fact that Minister Horn has taken time out of his schedule and Dr. Wary to come up here to Grande and to listen to what you have to say, some of the questions you have, I think shows the dedication of making sure that we don't leave you stranded. As Dr. Murray said, we're looking at a number of different scenarios that we can look at. I've been talking to the infrastructure minister about the provincial building. We'll be coordinating a meeting with corporate sponsors to see if we can do some things in getting physicians and nurse practitioners up here on a rotating basis. We're also going to be talking to Dr. Jill Conklin, who runs the rural development or the rural doctors development at the U of A, and I met with Dr. Conklin earlier this year. I met with the rural physicians about just this issue. So we have some support there too. So we will continue to work with the community. You know, and as the mayor said, this isn't a town council issue. This is a community issue, and we will continue to do everything we can to make sure that there is health care provided in Grande Cache. I can say to you that also I'll be taking over the NADC again. And again, so we have some opportunities through bursaries and that through the NADC to get some people into Grande Cache and help them with their education and actually help them with some of also their living expenses. So I'm not going to take too much more time. I think it's important that you have a chance to ask questions of Minister Horn and Dr. Wary. And if you have any questions you want to ask me later, that's fine. Or if there's anything you need to know, feel free to get a hold of my office, and we'll do all we can to make sure that we do the best job we can to alleviate this problem now. And again, more importantly, we have to look at the long term and make sure that we have a plan in place that's going to provide health care for people in Grande Cache for the long term. I know we have some immediate issues, but I think everything we do will have to also look at a long-term focus, because we don't want to be in this situation 2 years from now or 3 years from now. So we want to make sure that we're attracting people that want to stay in Grande Cache, that enjoy the north, and make sure that our hospital is functioning properly, and that we don't wear out doctors like Dr. Gillette. I mean, there's only so many hours in the day, and the fact that these people are doing the yeoman service right now is a testament to the kind of people they are. But we know that we have to move forward and we have to get some help. So I'll be on continually after Mr. Horn to do some things, but I know he will. And I've had some good discussions with Dr. Wary, and I'm pretty confident we'll get this resolved in the short term. So I'll turn it over to Louise, and you can ask us some questions.
Thank you very much, Robin. Well, I think we've already accomplished two key things tonight. One, which is always critically important in our community, is to get the facts. No more rumors, no more stories, no more I heard this, I heard that. Now you heard it from the horse's mouth. And your job now is to get out there tomorrow morning and to dispel all those rumors and say, no, I went to the meeting last night and here's what I heard. So that's great, and we appreciate that tremendously. The second thing is that we have established some very, very powerful connections. We have names and we have faces and we have somewhere to go, and certainly some tasks to follow up. But I think that's really, really important too, particularly given the time that we find ourselves in. We're going to have some changes in our community over the course of the next month and a half, and whoever is on council is going to be able to continue this initiative. So it's really important that this start now and that we work together to develop some kind of a plan that can be implemented pretty quickly. So that's a key task for us to do tonight. Before I take questions, I would just like to acknowledge a number of other people in the room. Mainly the ones who are standing the farthest away from me, and I'm not sure why that is, but we have all of the members of our council here tonight, a fabulous group of boys to work with, and I've done my best to whip them into shape over the course of the last couple of years. Councillor Rob Staples. Councillor Johannes Swart. Councillor Tony McCormick. Up here, front and center, Councillor Sean Moulon. And I know Deputy Mayor Herb is here there he is at the back, Deputy Mayor Herb Castle. So I certainly want to thank those individuals who have worked, and I know will continue to work very, very hard on this initiative. So thank you very much, guys. Okay, we have CAO Rick McDonald over there beside the microphone. This is your opportunity to ask that burning question or to bring up that burning issue. This doesn't happen very often, folks, so take advantage of it. The microphone is yours, and I would just ask you if you would just identify yourself, and if you're here as part of an organization or a business or representing industry, or if you're just I shouldn't say just if you are a citizen of the good town of Grande Cache, just give your name, if you would, please. And serial number. Okay?
That's down the hall.
Okay, while you're getting up your nerve, I have to apologize for the time change, and I suspect there will be some people showing up for a 7 o'clock meeting who didn't hear that it was starting at 6. We had to make that time change to accommodate the minister's schedule. Would somebody get up there and get in line? Ah, there you go. Thanks, Herb. Thanks, Sue. Okay.
Ministers, I attended a recruitment meeting last fall at the Mayfield Inn and found out that a lot of communities are making some serious financial commitments in recruiting doctors, and it really makes the playing field for us very unlevel, and that disturbs me, and I'm worried about that. So I don't know how we can compete with that, and I just would like some response from you to see what you see the future with that kind of financial support from communities for doctors.
Well, it's a good question, Herb, and actually, you know, it was something that concerned me when I was chair of the NEDC. I actually went to Wabasca and saw what they're doing there, and you know, it does create an unfair playing field. But I can tell you that one of the things that we'll be doing as soon as the municipal elections are over is that we will be calling all the northern mayors together, and the premier has asked to do this. And what we're going to do is we're going to invite AHS and some of the key ministers. I'm hoping Minister Horn can make it. And we're going to talk about recruitment in northern Alberta because, as I say, while we have a crisis in Grande Cache right now, we've got a crisis right across the north. And we got to come up with a plan that makes sense. So because of population and distance, we have some real challenges. But I think if we think outside the box, and we've done all the research through the NEDC, the papers are sitting there. If we think outside the box, I think we can come up with a solution that we can provide the health care that's needed in northern Alberta. Again, because of some of the challenges we face. And I've had some discussions with Dr. Werina, and I've had some discussions with Dr. Eagles about that earlier this year. So I'm looking forward to the mayor's meetings, and I'm looking forward to getting Northerners together and having that discussion and seeing if we can come up with a solution to that problem that you're talking about.
Thanks for.
I could just add to that.
Yeah, just to add to that, I think it's, you know, I am familiar with the kind of communities that you're talking about that have made those investments. That should be a last resort, if at all, in my view. And as Robin said, we've never really approached, you know, staffing healthcare in the north on a regional basis before. I don't know why, but the tradition has been that communities kind of fend for themselves. So we can use the NEDC as a way to do that. We can use some of the restructuring that we've done in AHS will allow us now to focus on a regional approach. So that would be my starting point. I think there are lots and lots of options to look at before a community has to resort to that.
Hello. Wow, that's loud. My name is Susan Fedema, and I'm the president of the Grande Cache Chamber of Commerce. And I wanted to thank you, Minister Horn, for coming, and Robin Campbell, and Dr. Weary, and our mayor. And it gives me hope to see the dialogue that's taking place here with the community. We've always, in my mind, had a wonderful healthcare system here. Dr. Gillette is an amazing doctor. He's my husband's doctor, and we have had a tremendously wonderful, I hear all these things in Edmonton, but in Grande Cache you go to see Dr. Wash, you get dealt with, and you don't have to wait the 10 years like everybody else does. You get, like my husband was up into the Grande Cache, to the Grand Prairie Hospital within 24 hours. So I think that the only hope that I can see is what you're doing here is dialoguing, and I think communication and dialogue is so important. And I don't know really what we can really do other than be supportive and to provide input, as members of this community. So I just wanted to thank you, and I'm just very glad that this is taking place today.
Hi, my name's Greg Cox. I'm with Grande Cash Coal. Thanks for coming out tonight. Obviously, very important to our business and to the community, and that's why everybody's here. I really don't know the answer to this question, and I suspect that there's some people that may have looked at it, but I am a little bit curious. As you have physicians leave northern communities or more remote communities, when they go to urban centers, is it the scope of work? What is really impacting? Why are they leaving? So, as an example, and just an example, if you did things like deliver babies in the Grande Cache Hospital, or other things like that increase the scope of work, could you make it a more satisfying practice and retain people that way?
No, thank you for the question. In general, and again, I turn to John and Ali for their thoughts as well, what we've generally seen is physicians will leave rural areas for different reasons. Some of them absolutely leave because they would prefer an urban style of practice. And I think John can probably articulate better than most. It takes a certain passion and a certain confidence and a certain willingness to go ahead and function across a broad spectrum of care to work in a rural and remote area. I personally share that same passion. I spent 7 years in Vermilion, and like being further away, like being, it's you figure it out. You have a team of support, but you're not dealing with a spectrum of orthopedic surgeons and a variety of other people that are going to back you up. I think sometimes we have physicians that leave for personal reasons. So personal reasons being a spouse, often that happens, or a child has particular needs, or a child enters a particular competitive sport or something that isn't available locally in some of our smaller communities. So we have docs that leave for those reasons as well. Generally, what we would attempt to do in the provision of service, so for example, when we look at obstetrics, is we would want to make sure that any of the service delivery that we offer is matched with what the local demand is, but also what can be done safely. We would want to make sure that anything we're doing, and for some things like deliveries, you have to do a certain amount of them in order to actually do them well. We know that from the medical literature. We also know that you need to have close enough backup support with C-sections and other things to also be able to do it well. But they're fair questions, and these are good questions to ask, questions that we ask on a regular basis as well. We perform exit interviews to try to look for patterns, to identify what some of the things are that we can change. And I think those are some of the things that we then try to discuss with communities as to how, again, we partner together to make it more attractive to not only recruit, but also retain.
I think Kevin covered it really well, but the Rural Physician Action Plan that I mentioned earlier is, in excess, I think now, of 20 years of experience in this. So that would be a very good resource to ask some of these questions. I suspect, you really, as Kevin said, you have to talk to the doctors themselves and find out both on recruitment and on leaving what the reasons are. But the one thing I would emphasize, and Dr.
And again, reward them accordingly. Having said that, physicians are independent practitioners, so yes, we run our own clinic and that's a private enterprise, and people would say, well, why are you getting support from the government? That's up to you people to decide. I'm not going to vote on that.
I just wanted to say, I think that's very fair comment, and the way that we pay physicians in Canada is changing. If you think about the population that we're serving, even in Alberta, we're a younger population, but our population is aging, and it's not the fact that people are aging that creates more demands on healthcare, but it's that as we age, people have more more in the way of chronic disease. So, it's very common. There's a lot of people that have diabetes and hypertension together. People live longer than they used to, and the time that it takes, and I think I'm speaking for, certainly most physicians I know, the time that it actually takes for a physician or other health professionals, for that matter, to actually deal with problems that people come in with is longer than the time that it used to take in the past. So when we put a doctor or another health professional in a position where all they have is a fee-for-service model to work with, there's pressure to see a large number of patients and to limit the amount of time that can be spent. And that problem becomes harder when you make the decision to work in a rural or remote community and you don't have the same support, as Dr. Gillette said, that people do in the cities. So one of the things that I spent a lot of time doing is working with the physician union, the Alberta Medical Association, to try to have more flexibility in how we pay physicians so that we can structure it in such a way that it's more attractive and it's an incentive. And sometimes it's not just about the amount of money, but it's the form of payment. So in some of our new models like family care clinics, we will have some physicians that choose to be paid on an hourly rate, for example. And that allows them, a fair and competitive rate, but that allows them to have more freedom to take more time to look after all of the needs of the patient. In Edmonton and Calgary, it's not uncommon to find in some medical offices, people are limited to one complaint per visit, and they have to make another appointment to come back. So you can imagine, for anyone, that's not a desirable situation, but you can imagine in a position like Dr. Gillette is going to be in here very quickly, where he's the only permanent physician in the community, that makes it a lot harder. So we do have a lot more flexibility now than we used to. The Medical Association is with us. They're working with us as partners in this. It's not something we're doing to doctors, it's something that we're doing with doctors. And I think that's part of the thing that has to be considered in the long-term solution in Grande Cache. In my view, what this is really about, is going to be about very quickly, is building the team around Dr. Gillette, both other physicians and other health professionals, that's going to make this a sustainable, a long-term arrangement that you can depend on, and your kids and your grandchildren can depend on. So it's a bit technical, but it is, I think it's important for me to actually talk about the context of healthcare and how it's changing. And it's not just about fee-for-service anymore. It's not about looking after one issue at a time. It's about looking after the whole patient and the whole family and the whole community.
So I should just dispel one rumour that you've obviously got that was going around Grande Cache, that my wife's moved to Grand Prairie. So that's not true, and she's one of the permanent physicians here as well.
I was going to say I'm a loud talker anyways. My name's Melanie McHale. I'm one of the nurses at work here. And Dr. Worry, did you say you had 2/3 of the doctor coverage for the short term?
Yes.
Is it worth mentioning what that 1/3 not being covered, how that impacts the hospital, the community, what that means for patients?
Absolutely.
I can try it? Okay, good. So I think it is worth highlighting that, and that's a fair point, thank you. One of the reasons why we work so hard that we have to fill all of the shifts is everybody here understands that when you're 145 kilometers away from Hinton, 190 from Grand Prairie, we have to make sure that we can have timely access, for care available locally. And that's, again, one of the reasons why John and Ali are working so hard to go ahead and fill whatever shifts they can. Ali works with a team of other people to, again, bring other physicians in. So there's a number of other locum leads that we're looking at, as well as trying to go ahead and land additional permanent physicians here, simply because the call responsibilities for Dr. Gillette alone, with one person, is absolutely not reasonable. So, and if I could follow up on one final thing that John mentioned, just as an aside, at times, while there's more of a historic model that physicians practice on their own, as Mr. Horns talked about, really it's a team of people that work together. And as you have a team of health professionals that work together, So people working in social work, you know, your nurse practitioners, your nurses, your LPNs, your social workers, a variety of different areas. You know, really, we don't want to be burdening our physicians with covering all of the salaries and all of the overhead of that team. That's simply not reasonable. It's one of the reasons why John and Dr. Durcell, so one of our other docs in town right now, you know, had applied for and have started the PCN, and they're looking at, you know, again, how can that advance the team and the support for that team. And I think some of the other things that we'll be exploring is what other supports do we need to provide beyond that, because we need to fill all of them.
Hi. Okay, I thought they'd be all lined up.
My name's Brian Atkinson. I'm a long-time resident of Grande. Isn't it possible to go overseas and get doctors to come in here and give them the license when they're fully trained?
Yes, it is, and there is, you know, there are a lot of communities in Alberta where doctors, they're referred to as international medical graduates. We have programs in place, and this stuff is all regulated by the College of Physicians and Surgeons, and there's room for improvement in how it's run, for sure, because there's still barriers to access that you know, I don't think we should have. But we actually have clinical clerkship programs, so we have programs where someone who isn't yet fully licensed in Alberta, who's come from another country, can work, say, as a physician assistant or in some other capacity with a doctor until they complete the training and they're fully licensed. We have the college has the authority to license all doctors in Alberta who come from other countries. And there have been some changes lately that we're working on with other provinces and territories, where it's we think as health ministers, we think it should be easier from particular countries for doctors to get, you know, faster or immediate licensure in Canada, and they're not being able to. And I won't go into all the details. But it's something that it's actually more than just a provincial problem. It's a national problem, and there are more doctors that I think would come here if we made it easier for them to be up and running and practice faster. Now, in some cases, you know, it's an important judgment call to make, and I can tell you, you don't want a politician like Robin or I deciding if a particular doctor is you know, should be able to practice in Alberta. But there are a lot of common sense things about this that we as health ministers have questions about. There are countries that have very similar curriculum in their medical school to what we have in Canada, and a lot of times it's hard for me to understand what the rationale is for a particular doctor not being able to, you know, to come and to practice sooner. So it's an option. It's certainly something that you should look at as part of your strategy as a community, is the International Medical Graduate Program, and we're here to support you with that, and so is the College of Physicians.
Thank you.
So maybe I could just mention in follow-up to that as well, the new physician that will be starting in 2014 is coming from internationally, so is coming from a different country, but perhaps closer to home. You know, Dr. Gillette, Essie, a number of the docs we've had in town are international medical graduates, so they've trained externally and come here. A number of the docs we're looking at to do some of the fly-in, fly-out work, same thing. Allie spends a good chunk of her time looking at, you know, some of the areas where we have a better chance of bringing in international medical graduates. So whether you're looking at overseas, you're looking at Britain, Ireland, Australia, New Zealand, South Africa will come up. We try to make sure that when, you know, we're dealing with other countries that also have their physician resource management issues, that we allow those physicians to come to us. So we try to handle things respectfully, but at the same time, we absolutely look internationally, sir, and we need to continue to do that. And one thing I should also mention is an apology for, you know, with some of the information I passed along to Minister Horn. So while John would be left as the sole physician doing call in the community, wouldn't want to suggest that John's getting a divorce and Essie's leaving him or anything. So because they took me to dinner at the Wildflower last time, and if I'm pushing that, I won't get invited for dinner again. So.
So I just was going to make a comment about the international medical graduates and what the minister can do to put pressure on the college, because we did have a physician who was as qualified as a physician who left here 18 months ago, and that physician is now going to work in Saskatchewan because the college refused her licensure in Alberta.
Good evening. My name is Michelle McDonald. I'm the Executive Director of Asiniwiji Nation and a longtime resident of Grande Cache. And I guess my question is more of a process question. I appreciate all the hard work that's been done to cover the 2/3 of the doctor's hours between now until Christmas, and I appreciate all the other comments made about the Rural Physician Action Plan and, light comments. But I guess what I'm really wondering is how do we keep informed as residents of this community on what's happening? Because it's really frightening to think that we're only going to have one doctor. Dr. Gillette could be in the ambulance going to Grande Prairie, and I could go in there with my child, and there's no doctor. And I think what would really help us if there was a plan. I know that, I plan on staying for the workshop and contributing my thoughts or my input, but how do I know what happens to my input after this? And how responsive is the provincial government going to be to that?
Just a wonderful segue into my key point, or the last point that I would like to make. And I know that Kevin is getting antsy back there, and the ministers unfortunately do have to catch their plane. One of the things that we want to do tonight before you leave, well, two things actually, but one of them is to form a committee, and we can call it whatever we want to, whether it's a recruitment and retention committee. But as I said earlier, this is your issue, and we need you to help out. So if you are interested in serving on a committee that is going to take this forward and make sure that we follow up on some of the great ideas that have already come forward, to make sure that we communicate to the community what's going on, to make sure that we liaise with whoever we need to, please put your name on that committee list. And I'm going to say that's that white piece of paper right over there. There's a black pen underneath it. Put your name, your phone number, your email address, or whatever, and then we can call a meeting just as quickly as possible to solidify that community, that committee, and come up with some specific strategies to do short-term, medium-term, and long-term. So that's one of the things, and I suspect.
Also, Michelle, I'm going to work here in the next couple of weeks. As I say, I'm going to talk to Dr. Conklin, and I'm going to talk to industry, and I'm going to see if there's some things we do in the short term. I have some ideas that we can do to get doctors in here on a rotating basis. I know it won't be the same as having a family doctor, but the most important thing I think right now is making